Good morning. We are in the Fit on the Go team, and we have Dr. Deepak Bhatt from the Harvard Medical School, the Heart and Vascular Center. He's the executive director of the interventional programs and a professor of medicine at Harvard. Thank you, Dr. Bhatt. I'm Sahil. I'm one of the fellows in training at New York Medical College. So I have a few questions for Dr. Bhatt. One of them is on the leadership for fellows in training. What does he think the future holds for the fellows, being involved in committees, in leadership, and what is his take on encouraging the fellows to come up, step up, and be part of the committees at ACC?
Well, first of all, thank you for having me. I think that's a great question. I think ACC provides a great opportunity for fellows to be involved in leadership positions, to learn about the ACC, to learn about cardiology. It's obviously a time of great transition in healthcare. There's a lot going on in healthcare right now. Makes people nervous, makes fellows nervous, it makes folks that have been in practice for years nervous. Everybody's nervous, but instead of focusing energy on anxiety, I think it's actually an opportunity to grasp positions of leadership, not just within the ACC, but more broadly within medicine, within your own hospitals, within your own healthcare systems, and try to help shape the change that is definitely going to be occurring in healthcare. And I think fellows are very well positioned because they're young, they're energetic, they're ambitious, and it's most relevant to them in their futures how healthcare is reshaped. So I would definitely encourage fellows to explore all sorts of leadership opportunities. In fact, I think the healthcare systems of the future are going to rely on physician leadership even more so than is the case now, because ultimately the most cost-effective, most efficient healthcare systems, I believe, are ones that are physician-run. And of course, we need good people, administrators, MBAs, that sort of thing to balance the books. But ultimately, those key decisions, especially when it comes time to think about tough decisions, rationing resources, those should be decisions made by physicians and by physician leaders.
Thank you. Another question is, how has the meeting changed for you when you were a fellow and the opportunities you have for us as fellows? Do you see a change in the last decade, if I may so say?
Sure, there are a lot of changes. You know, one big change just has to do with the way meetings are. When I was a fellow, one of the big things about coming to the meeting was going to a late-breaking clinical trial because you really didn't know what the results were until you showed up there. And if you didn't show up there, you wouldn't know the results until a certain lag of time passed. Now, of course, it's totally different, right? You can sit at home and find out the results by tuning into acc.org, you know, a minute after the results are presented, sometimes even right before the results are presented. So it does change the dynamic a little bit in terms of, you know, what is really getting one's juices flowing. But I think an important part of meetings like ACC, for me as a fellow, and that continues to be important, is the ability to network. And that's something that I think fellows shouldn't underestimate. And a lot of times, you know, it's fun coming to the meetings, you see your friends, you go and do fun things with them. And that's good, and I'd say keep doing it. But beyond that, it's a great opportunity to network in professional societies like ACC, but also AHA, HRS, SCI, other sorts of organizations allow that type of networking. And I think that's really good because if you're trying to figure out, maybe I want to go work in California, you know, talk to some doctors from California, get a sense of what the practice climate's like, get a sense of what the practice opportunities might be like. If you're interested in academia, you know, feel out different people at different institutions. Sometimes not all the positions that are out there are advertised, and, you know, unless you sort of network and talk to people, it's hard to know what opportunities there might be for you. So that aspect, I think, has stayed the same.
And the last question would be, how do you see the future of ACC, in your opinion, 10 years from now?
Sure. So I think it's really a rosy future. I may be biased. I actually am just joining the Board of Trustees of the ACC as of this meeting, as a matter of fact. So I think the ACC is in great shape. And I think it's well positioned to influence healthcare reform as it's unfolding, in particular pertaining to cardiovascular disease, but even more broadly. So I think it's a great time for ACC. I think it's a great time to be an ACC member. I think it's really important for fellows to be part of the ACC, not just when they're fellows in training, but even as they move on to academic or practice positions. And the reason for that is we've got to be united as a profession, because if we're divided, we will get crushed by what's coming with healthcare reform. And by crushed, I mean things that'll be bad for our patients, lower reimbursement, not enough resources to provide safe care. I mean, all those potential bad things are coming, unless we're united as a profession. And sure, not everybody's going to agree on everything. That's, common sense. But still, I think there are things that do unite us. I think every cardiologist and allied health professional providing cardiovascular care would agree that we want what's best for our patients, and we can advocate for that, and that's something ACC does.